afternoon, everyone. My name is Denton, and welcome to the Patagonia Health webinar series. Today's topic is going to be, can we bring joy back to healthcare? We have a very special guest with us this evening. Her name is Amberly Berry. She's a healthcare strategist, technology SME, and nursepreneur who advocates for careers in healthcare and the retention and expansion of opportunities for clinicians. After bedside nursing and clinic management, she led technology and quality consultancy engagements, but never lost track of her passion to keep our valued clinicians in the profession that we all need in our lives. So without further ado, I'm going to pass it over to Amberly. But before I do that, I do want to just give you some housekeeping tips here. So if you see at the bottom, you'll see a chat. You'll have the ability to raise your hand and Q&A as well. If you want to participate, we absolutely welcome it. So just click on that chat button and send us a message and we will get to it. And other than that, take it away, Amberly.
Thanks. I want to make sure everybody can hear me okay. Denton, you can hear me?
I can hear you great.
Great. Okay. Thanks everybody for coming. I really appreciate it. I'm going to turn my video on just so you can see me. And if you want to turn your video on, feel free. If not, I totally understand. I know it's a busy day. Tuesdays aren't a calm day for healthcare. But let's get started. So this webinar is really about, can we bring joy back to healthcare? And as Denton said, I've been in healthcare a long time. This is sort of what is my passion project today. A lot of it is because after years in nursing and having done all different kinds of clinical jobs, leadership jobs, technology jobs, I'm kind of astonished at the number of nurses and just every other kind of role that is leaving healthcare. And they may change jobs, which is great if they stay in healthcare, but with the volume of folks we have, entering into older years and needing more healthcare providers, it just is sort of disturbing to me that we have people leaving healthcare altogether after all that education. So I've kind of made it a passion this year to focus specifically on retention. And one of the things that has come about from research I've done and working with many health systems and clinics across the nation is we don't really have the joy and kind of compassion and camaraderie and even what I guess you would consider connectedness that we've had in decades ago. So there's so much transient jobs and folks that leave after a couple of years that we've kind of missed that sort of friends and family feeling of going into the health system. So when we focus, solely on the burnout and just the stress of understaffing and such, it's just made it incredibly hard for everybody. And I'm sure everybody on this webinar understands that and is experiencing that. So the agenda today, we're going to talk a little bit about the challenge of retention and clinicians leaving healthcare, and then get into successful strategies. Some of these are kind of more modern social media ways of addressing retention, and why is joy as a focus something that is gaining a lot of traction. So according to 2023, which is really one of the most current studies that focus specifically on nursing, 18% of newly licensed registered nurses quit in the first year. So 1 in 5 are quitting. Now, many of these are going on to other jobs at other organizations, but just the fact that after 1 year, someone's leaving, and that 1 in 5 are leaving after all that work to onboard them and get them accustomed and trained in your facility, that's a staggering, and it hasn't gone down. It's like 17 to 18% in 2024, according to some of the studies now. And then according to an HCAI study, which is 2024, specifically around non-prescribing licensed behavioral health clinicians. So this is not physicians and nurse practitioners, but the rest of folks working in behavioral health. There's a 37% gap. And I'm going to focus for a second on California. These stats are not that much different state by state between supply and demand for licensed behavioral health. And then substance use disorder counseling faces an 18% shortage. So besides having retention issues, we have a growing need, and we're not going to be able to cover that need. So we really need to focus on keeping folks in healthcare. Finally, an NSI, National Health Retention and RN Staffing Report, said that it's not just RNs, it's not just LVNs. The patient care technicians and CNAs are outpacing everybody else. So we have some strategies, especially around these roles, for keeping them in healthcare. And so that's another thing to focus on specifically, is it's really everybody that is a clinician, whether it's respiratory therapy, behavioral health, CNA, RN, even physician and nurse practitioners are a little bit less, but still it's everybody in healthcare right now. So this is the interactive part. So anybody that's on that's willing to hit the bottom button or hover over the bottom and hit the chat button. If you can help me out, I'm always looking when I'm doing webinars or when I'm on site at a health system to find out what they believe today is their top reasons for clinicians leaving. So if you can kind of put in the chat what you see there, I'm going to try to see if I can look at the chat while you're entering. It can be your top 1 or 2, or if you've done a study and you have 3 or 4, that would be even better. We'll give you a minute because then we'll jump to what some of the reasons are. I see 8 answers, but I'm not looking at them. I don't know, Denton, if you want to say a few that you see.
Yeah, so coming in, we have salary,
Yep.
staffing issues, productivity expectations, a lot of salary. Salary is coming in a lot.
Yep, salary is definitely a big one. So this may be surprising to you. I'm going to jump to a study that was focused solely on 2024. So when you think about what's happened post-COVID, and we had a huge influx of travelers and registry and such. And from that, there was some resentment built on folks that have loyalty to their organization, that travelers were being paid more, registry was being paid more. And so there has been in 2023 and 2024 a great deal of work around salary and benefit packages. So I'm going to just show you, like, this is the 2024 only. So we're kind of excluding what happened immediately post-COVID and really jumping to what's this year's challenge of retention. And so these are in order. So even though salary is definitely on there, number 3 for sure, if you think of burnout, job demand, understaffing, which you all brought up, those kind of bucketed into the same thing of just, this is a really tough time to be in healthcare. And then lack of leadership, really, this is more like not just lack of leadership, but it's the skill sets in leaders and sometimes the skill sets in middle management and leadership. And I do quite a lot of seminars specifically on leadership, not just in nursing, but in every area of healthcare, and what it means to be a leader, how to create those skills in someone who maybe is uncomfortable with leadership, but they're well respected. How do you precept them into leadership roles and such? The final 2, which you've really only been talking about incivility a lot over the last 5 to 10 years. It's always been there. And this encompasses bullying and some other things. And I'll show you some statistics on that. And the last one is being undervalued. So probably none of these are truly a surprise. But the fact that salary is lessening a little bit because it's not just about pay, not that pay is not incredibly important. So in regards to incivility, which really is also safety, not just safety as far as the nurses and other healthcare workers, but also safety of patients. But incivility is really, it's bullying, it's aggressive, rude behavior. And for some reason, the healthcare industry seems to have a decent amount of this, which we all join because we want to care for patients, but the stress and such can get to you. So incivility toward nurses is as high as 46%. And this is a recent article this year. And 31% of physicians report receiving weekly or daily rude, dismissive, and aggressive behavior from other doctors. So it's not just in doctor to nurse or nurse to nurse or other healthcare providers. It's kind of across the board. One of the things that is important in this, and we'll get into strategies later, but it's kind of shocking to me that only 70% of institutions don't have programs around properly addressing incivility and violence. Maybe it's something that it's just, tough to have another program out there, but there are a lot of tools out there that are available that are free. I mean, Organization Nurse Leaders has this self-study guide, which you can, deploy to employees. This book by Catherine Manning, I attended a seminar with her, and she works for basically everywhere in regards to violence in the workplace. Also, school shootings. She's on site when there's a shooting at a school or there's some major event that happens across the US. She's worked with the FBI. This book, and I am a book kind of person in the sense that I read this in a weekend, but the strategy is very specific steps in there of how to approach others in the job and how to work on this incivility that's in the workplace. So great book. But there's a lot of opportunities out there to set up programs, nothing that you have to spend a lot of time on because a lot of the framework is already there. But this is really important because any kind of incivility in the workplace can branch over to incivility with patients. And I think we're well aware of that. So something to work on. The last one we saw in that list of 7 was being undervalued. So 80% of people leave their jobs because they feel undervalued. And 42% of healthcare workers feel unappreciated. And that's the Pulse 2024 survey, which was a pretty decent one by their manager or supervisor. So this isn't necessarily like the managers and supervisors are doing a poor job. This is the feeling of the healthcare worker in how they're feeling about being recognized. So there's a lot of reasons to find ways to improve the feeling of our employees to feel more appreciated. But the other aspect to it is 14% increase in productivity. And there's even an increase in actual revenue for health systems that put in programs that focus on recognition and appreciation. So it benefits the bottom line as well. So if you're ever trying to get a program through and everybody's having an issue with operations and margin, it will actually increase productivity. So that's a great Forbes article. Then there's finally the cost of retention. So retention costs in 2023, 4.8 million for turnover, all the costs that are associated with turnover from training, onboarding, termination costs, and that shouldn't be surprising. 31%, in behavioral health specifically, the turnover rate's 31% would equate to, if you had like 100 clinicians and 31 leave, that's an annual toll of 372,000. So no matter what kind of an organization you work in, whether you're a smaller organization, losing 31% of your staff, or for acute care hospitals, it's 16 to 18% right now of the nursing staff. This takes a huge financial toll on the organization as well. Before we go into strategies, and I know I'm going kind of quick, I'm a fast talker. Does anybody have any questions on what we just went over as far as retention and some of the challenges that we're facing in healthcare with trying to hang on to our employees? You can unmute and talk if you want. If not, I understand. Well, let me jump into these and we'll see if anybody has any questions or any ideas as well. So the Great Resignation, I mean, we talk about that. It's kind of all over social media. It's really in healthcare. Besides COVID, it's just more of like what the stresses are in our world today and some of the younger generations and how they're feeling about their jobs, how much they want to work, that work-life balance that may be different generationally as we have different generations of employees. And it's tough to balance that. If I look at specifically strategies in 03, so 2023 to 2024, some of what we worked on for retention was what we talked about. We really did work on increased pay and bolstering benefits. And it could be as basic as actual pay, sign-on bonuses, increasing the actual wage, increasing new hire pay. We had minimum wage scales affecting some of the roles in healthcare, which was great. And then referral bonus programs. We also worked on benefits. And in a way, we worked on them with the idea that we have issues around burnout. We have issues around understaffing. So flexible work options, personal leave, parental leave, and then in kind of giving back and helping folks get to that next level in their education and the roles so that they can make more money. So tuition reimbursement, student loan repayment, and then backup childcare, on-site childcare. This is not that it hasn't been around, but this is definitely an area where that ability to have more flexibility with where you work and childcare has been huge. And I think we're seeing a lot more of that even in 2024. But these were kind of the strategies the last couple of years in response to retention. So what is new and what do we still have to work on? So these are 4 areas of focus that I've seen over and over in my research. is just something that cannot be, and it's not anything new. It's more of how can we focus on these strategies even more in regards to our employees so that we can get programs around these or make sure that they're infused in everything that we're doing. Are we having effective communication? Are we innovating engagement with our employees? Do we have a relentless recognition? And what about this idea of joy or love? And just to give you a little bit of an idea of that, Adventist Health included be love as part of kind of their focus, their mantra, Mayo Clinic, joy in the workplace. And we'll talk a little bit about how you feel about that as well. So for effective communication, focusing on communication that builds a community that fosters trust. So sometimes if you're building communication, it's a one-way street. Definitely you want feedback, but you also want to provide confidential opportunities to be for employees to be heard. And then once they're heard, the trust comes from actually doing something about what you hear. So taking these things into consideration, creating work groups so that you can, use design sessions to learn more about what is needed. All these things are really important. Also leading with a tone of caring and love. We're very busy. We'll do this with our patients, but it's pretty sad we're not necessarily doing it with each other or as leaders. But everybody's going through a lot. We know the stress that our healthcare workers are under, and sometimes we don't even want to bring it up because we feel like we're bringing up something that is already, something that we can't do, quote, a lot about. Like, how much more money can we spend towards staffing? And we just feel, what if I can't respond to that? But a lot of it is being heard and having your employees come up with suggestions. And then be relevant with communication through social media and be thoughtful through handwritten notes. So relevant communication, I mean, like we have all different generations of folks. Somebody might feel really grateful to have a handwritten note, whereas others might need a platform for communication where they can talk with each other and you can build that community that is kind of lacking today. And then create an environment. We don't really think of this, but it used to be 20, 30 years ago, you actually had a trusted family at work. So you had employees and leaders who actually became your friends. I have folks that I've known for 25 years that I met as a bedside nurse. And that's tough now when we have so much turnover. And so this retention is really important. But giving the opportunity for folks to see each other outside of work, we'll get into a little bit more of that. Any questions or comments? I'll keep going. So innovative engagement, I think we all have, ways of engaging employees. And I think from HR to leaders to just, teams that we create and teams that work, we create engagement, but are we innovative enough? And I think one of the top ones that we're learning today is engaging employees outside of work. I believe if you think of somebody working 312s and they're just exhausted and all they want to do is get home and have their 3 or 4 days off, or 2 to 4 days off, whatever the case may be, they don't want work invading that space. There is some truth to that, but the more recent studies have shown that if you engage in a joyful, positive way outside of work, it reminds folks that there is a positive aspect to work. So incentives for shift pickup, a reward program for tenure milestones, congratulating quality result participation, and really giving more of those positive aspects outside of work. So there's platforms we'll talk about later that you can implement that allow this kind of positivity to come through outside of work. And again, on a phone or, in ways that are a little bit more modern that people are kind of used to having come in front of them, like TikTok and such, but not necessarily something they're scrolling through, something that they can control how much they're receiving of these kind of information. And then engage in hosting communities. So you're hosting interactions for your staff to build relationships outside of work. So allowing a community where you can give rewards and people can join fitness teams, movie nights, children play dates with each other. You can discount certain, movie nights for a group to go to and build rewards towards that from having longevity with the company or from, being able to achieve some quality goal. So this kind of innovative engagement is something that's really positive. It's something that you may think, well, how much time do I have to spend on these folks outside of work? Is that really worth it? But the positivity and not the negativity is what that's all about. It kind of balances out those stressful times at work with kind of reminding people why they're there and what kind of folks they work with and know that they're appreciated. And I say relentless recognition because we had a little period of time where recognition was considered, well, some people don't want to be recognized, they get embarrassed by it. That's a very small percentage of the population that does not want to be recognized. The majority of people need to feel recognized. And so a consistent cadence of recognition, not where it comes along on National Nurses Week or something that's an occasion or setup, but a way to have unapologetic joy about your employees in a more consistent way. It reminds them of how they're valued. You can get very specific in how people are making a difference. So those handwritten notes about a patient, appreciating someone, but they didn't get to hear it because it was said to somebody else. Those are huge in even peer-to-peer recognition. But a lot of it is the small things that providing feedback consistently, doing it for positive reasons and not just for an evaluation or such. Also, in any kind of feedback, it's also balancing. Oh, we have a question from the audience. Sorry. I'll stop on this one and we can see what it is. So, how do we do that in local government where how we spend taxpayer money is so crucial? Okay, so I don't know who asked this, but are we talking about, just so that I know, are we talking about implementing programs and the cost of that? Or did I miss something? Sorry to put whoever on the spot, but
So it's a question from Lisa, and she said yes to answer your question.
yeah, so you're talking about like the cost of these kinds of programs and how would you be able to put those into effect? So some of these things can be are maybe something that you already have, and this is about kind of getting it into modernization. I mean, I'm a techie nurse by heart, so I'm going to always say that anything that can be automated is going to be more consistent, more regular. And there are now applications out there that are not super expensive that allow you to take some of, like, for instance, your paging system for shift pickup, or some of your benefit package engagements and add aspects to it without spending a lot that actually get a little bit more into this modern way. The other thing is just creating teams within your organization that include frontline workers, front bedside, workers, that the team itself is the one producing this. And so they feel that connection to doing it as well. I know that margins are really tough, but part of what we talked about with retention is it costs way more, to lose these folks than it does, to keep them and support some of these programs. Just to give you an idea, there's some app-based programs out there that are downloadable that are free. Then there's other things out there that have a cost that you can customize to your organization. So unlike like the cost of, some of putting in programs that have a lot of interaction with technology, for instance, or, you're worried about ongoing support of them. Some of these things can be supported even by your quality measure programs. So I'm going to get into a couple of those later, but I'll definitely see if I answered that question as we keep going. Did that answer a little bit? You can give me a thumbs up or. The last one is balance the quality measure results by recognizing improvements over areas of concern. So, I'm a quality nurse by background. I would say that most difficult thing is to have frontline staff that are working with patients directly understand their impact on quality measures on a day-to-day basis, right? Like you don't think about quality measures, and nobody does well with quality measures across the board, across all your programs over periods of time. It's just not possible. So it'll ebb and flow with how much time and energy you're focusing on it. But one of the interesting things is a lot of the process measures that improve quality measures are about what the clinicians and staff are doing at the point of care each day. And we're not necessarily always recognizing that. So it's as simple as peer-to-peer recognition or manager-to-peer recognition over hand washing, over monitoring lab results and noticing a change where someone is starting to head towards an infection. It's about just those consistency that you recognize. And there's some programs out there where you can infuse some training, give folks points for training on quality measures, but they can do it at their leisure and their off time. And then by recognizing the process measures that they do that impact, like hand washing, like isolation precaution, even in patient acquisition, taking the time to teach patients or referring for uh, pharmacy referral if there's a really complex list of meds, or just being able to spend that time. And I know that I'm saying this during a time when we're talking about understaffing but these are important because patient activation measures and quality, they align with patient satisfaction scores. And so just that recognition that you took a training offline when you weren't at work, you got some reward points that you could use towards something. And at the same time, it's kind of that behind the scenes recognition that I'm part of this quality. And then then there's improvements, definitely recognizing that. I know I spent a lot of time on that, but so relentless recognition is a huge factor. So before we get into the next section, so what about joy? Can we bring joy back to healthcare? So I think if anybody's willing to speak up, otherwise you can, throw something into the chat. But does the word joy in healthcare resonate in a comfortable or uncomfortable way with you right now? So if you could just kind of drop that in like kind of uncomfortable or I'm comfortable with that. Like I said, Adventist Health, I'll just, while you guys are dropping that in the chat, I'll read to you what they say is their aspect beyond joy, like we have at Mayo Clinic, joy in the workplace. Adventist Health said, be love. Love matters. Treat yourself with love and care so that you are free to love and care for others. So how comfortable are you with this aspect of it being something, sort of something you'd associate more with family and friends and such than actually with coworkers? Oh, I guess people don't have that ability to speak in the webinar. Sorry, I didn't know that. So I'll look for those responses. And you're helping me too, because the whole idea of this is bringing joy back to healthcare. I think that when we're in training and when we're learning our job, there may be some uncomfortableness, but in really creating a difference in people's lives in healthcare is 90% of why people go into healthcare. So how do we get past a lot of this burnout, a lot of the incivility and things, and really focus and bring joy as, the forward feeling? So when we look at what joy is a feeling, the emotion of great delight, happiness caused by something exceptionally good or satisfying. Joy is elation. So clearly we would all want to feel this. But how do we bring that in the day-to-day of working with our employees in healthcare? And again, how comfortable are you with infusing joy into your daily work life? So here's why joy is important. So specifically on studies and programs that promote joy or love or both, they help with the absence of burnout. So joy plays a role in combating healthcare workout burnout by addressing emotional, psychological aspects of the work environment. So when you're focused on joy, you're focused on an area that's positive for psychological well-being and individual wellness. So feeling satisfied, feeling fulfilled, reminding folks why they're in this role is really important. Feeling valued and supported. So joy does all of these things. If when you're, engaging in a program, are you infusing joy into that program? And we just talked about how you could do that in quality, which is probably one of the tougher ones. It improves engagement. So employees that are engaged have positive interactions, and then they're likely to stay committed to their role, and they will provide valued feedback to you. And finally, patient satisfaction and improved outcomes. So if you're feeling joy and you're feeling better about work, you're going to pass that on to your patients. You'll feel engaged, motivated, and attentive and invested in patient care. And that will make you focus on the patient care that you're giving as well. So a couple of things that were from the last question is joy includes creating an environment that reflects joy and fun too. I absolutely agree with that. Due to the busy nature of day-to-day schedule, joy tends to come more from work with patients. I love that too, because obviously that's the most important aspect of where you really recognize it. I think and I love that. I mean, there's nothing better than to experience joy with patients. That's why we go into patient care. It's how do we also take that and infuse more of that into our interactions with each other and then with leadership. So I'm going to give a few real life examples or real world examples here. Let me move this out of the way. So ensure a system-wide approach. So if you're building a program that is joy with retention, joy with engagement with your staff, and however you want to name that and use those words in there, build a trusting culture, which means everybody has to believe that joy is a factor in a positive culture. Um, I don't want to say like you have system-wide approach, everybody has to agree with this, but you overall have to feel that this is a positive, whether you use the word joy or love or care in that, but it has to be kind of forward that it's a positive feeling across the board. Develop balancing communication, employee engagement. So emphasizing the positives over criticism, lead meetings with a positive intent, provide one-on-ones just for positive feedback, not for any other reason. And we have such little time that we don't always do this. But if you infuse this once a day and just start to recognize the change, it will allow you to do it more and more and find the time to do that. And then create a confidential feedback loop for employee suggestions. So I think one thing we do is we make assumptions around what our employees want. And I think a lot of them are correct because we've been around them and we understand. And maybe if you're like me, you read research on it and see if that, gleans any more light into this. But it's asking the right questions with not driving any kind of expected outcome. And IHI has a template for actually creating a foundation of joy for retention. And this is one of their main foundations, is asking the right questions. So if I go into an organization and I'm creating a retention program, I mean, I'm not sure how many of you are aware there's roles now specifically just for nurse retention and just for employee retention in healthcare. And these folks work with HR, kind of work in between HR and leadership, and they're there solely to be able to understand better what retention means in their organization. But a lot of their role is in figuring out the right questions to ask, getting a confidential feedback loop so people feel free to say what they need to, not waiting for exit interviews. So this is an important part. So again, it includes engagement, communication, and sort of that system-wide approach. The three other factors are supporting advancement. And so I think a lot of folks either have some form of career ladder or advancement. Maybe it's an informal with more with HR, or it's a mentorship with the leader directly associated with your role. But supporting advancement can come in many forms. It can be task or skill advancement. We just left a facility the other day that said that, they want more nurses to learn central line. They want more, of their CNA population to recognize an easier career ladder where they don't have to drop out of their role to be able to go to school. It's tuition reimbursement, like we talked about earlier, as part of the benefit package. Leadership training, like we spoke of, where a lot of folks that would like to get to the next tier maybe don't feel they have the leadership skill set, or we may not feel that they have the leadership skill set, and it may just simply be they haven't been exposed to it. And so making sure that you're offering leadership opportunities. And then diversity and aligned precepty pairing. So I love this idea. So if you have a preceptor program, if you haven't asked people, and this again can be confidential feedback, but it helps with your diversity programs as well, is what kind of person do you want precepting you? Is it just role-based? Usually it's not. It's I want someone with my same language, my same race, my same gender. And so pairing people, almost like a Match.com, preceptor and preceptee, has had a really great response. It also just these kind of programs and investing in them and getting feedback from them allows folks to show that you're supporting. And you have to almost do this with the idea whether they stay or not, because that's truly them feeling appreciated and valued for you caring about their future. So sometimes you literally advance somebody right out of your organization because there is not a place for them at that time. But a lot of those folks will come back because you've created that loyalty by caring about them and showing them. A peer recognition program. Again, a lot of folks have like maybe where you're recognizing milestones, but birthday announcements, quality measure improvement, like we talked about earlier, but doing this in a weekly way. And so there's apps out there that you can use where you're recognizing folks offline. You can do rewards and point systems. And if anybody's interested, we can talk about that, how that would work with unions and such, because we've kind of had a lot of those questions when we talk about what kind of rewards programs can be offered for retention. And then utilizing a platform that allows varying engagements for moments of joy, like literally just naming it, where you're able to, you know, provide the kind of peer recognition like we talked about above, provide reward-based picking up shifts and things, but recognizing folks for doing a great job or meeting quality measures, but doing it in a way that's more maybe even social media oriented. And you would be surprised at the engagement when it's those kind of a platform, because these kind of things we don't necessarily, they don't look fun, or they're not necessarily something that, other than in paper form or in an informal way or a once a year, once a month thing, is something that people are feeling. So there are ways that you can do rewards and have kind of a social media feel to that. And for younger generations, which are the ones that have the highest turnover, where 1 to 3 years is really where you're looking right now, sometimes these programs can actually make them feel more connected. Healthcare, tends to be kind of the last to adopt some technologies and stuff, but these kind of platforms are actually cheaper than a lot of, the types of programs you might go into. And they could replace, like I talked about earlier, with the recognition of the cost of these programs, they can replace something that's kind of archaic and not working well. So there's always that to consider. So in final thoughts, and then I can take some questions if people have any. So eagerly learn about your employees. There's nothing that's more important than this. Just asking questions, feeling engaged, asking people. I know that one organization just recently brought their patient satisfaction scores up unbelievably by leaders and middle management going out on the floors, asking patients how they're doing, recognizing the employees that are discussed during these positive interactions. Is huge. But knowing more about your employees, knowing more about what is important to them, what brings joy in their life. If they, if you need to reward another day of PTO, if you need, to understand what it is that would bring joy to them. And this conversation is so positive. It's an easy way to get started by just simply asking that question. And then focus on those factors we talked about: communication, engagement, and recognition, and then building just an unapologetic culture of joy. Don't be embarrassed at the idea of this. We're not joyful all the time, but really leading with a positive just view and tone on everything. It trickles down, and I think that that's huge, and employees love that. Do we have any questions that are in the chat? I can go to the chat too. And
I don't see any right now.
okay. So, and just for, in regards to, I have a company called Palm Women. It's really about keeping clinicians in healthcare. Um, most of what I'm doing right now is going out and speaking about these kinds of programs, how to get them funded, how to use grants, how to deal with retention and rewards, and different incentive kind of programs that allow recognition when you're dealing with unions or you're dealing with, county facility rules and such. So if you have any questions, feel free to email me. And I think I'm giving a little bit of time back, which actually is never a bad thing. But if there's any questions you have that you didn't want to answer necessarily on the webinar, feel free to email me at the email associated right here.
Awesome. Thank you so much, Amberly. And thank you everyone for joining us in our webinar today. And if you are also looking for any more resources on healthcare retention, you can also visit us online at patagoniahealth.com. But we appreciate all of you, and everyone have a great rest of your day.
Thanks, everybody.